The Substance Abuse and Mental Health Services Administration, or SAMHSA, created the Wellness Initiative because people with mental and/or substance use disorders tend to die years earlier than the general population. Studies show this is mostly due to preventable and treatable conditions such as diabetes, heart disease, and cancer, which can be improved by healthy eating, increased physical activity, and smoking cessation. Focusing on health and wellness is particularly important for people with or at risk for mental and/or substance use disorders so they can live long, healthy lives. SAMHSA's goal is to help individuals, families, providers, and communities improve whole health outcomes. Keep listening to learn more about wellness and tips you can apply in your life.
Hello everyone, my name is Kathy Cave. I'm the co-director for SAMHSA's Program to Achieve Wellness. Welcome to another episode of SAMHSA's Program to Achieve Wellness podcast series on chronic pain management. We're excited to be a part of SAMHSA's innovative initiative offering new and exciting information about alternative treatments for those experiencing mental health challenges and behavioral health providers. Today, we will talk with two individuals who offer alternative treatments for chronic pain management and learn some of the science behind these techniques. I'm excited to be here today with Jeanne Supin and Teresa Baltzell. Jeanne Supin is a behavioral health consultant specializing in organizational transformation, change, and leadership excellence. She also has decades of experience with many alternative therapies and is founder of AlternativeBehavioralHealth.com, which provides continuing education and training to providers interested in integrating alternative treatments into practices and service arrays. Teresa Baltzell is a board-certified acupuncturist who specializes in neuroscience and neurophysiology. She has over 20 years of experience in the healing and healthcare field. She practices in Greenville, South Carolina at Carolina Health Center. Chronic pain, anxiety, and autoimmunity are her specialty. So let's get right into this conversation and welcome everyone.
Thanks, Kathy. I'm Jeanne Supin, founder of AlternativeBehavioralHealth.com, and I'm delighted to be participating in and supporting SAMHSA's Program to Achieve Wellness. Exploring alternative ways to address chronic pain is so important and such a timely topic, and I'm honored to be invited to contribute. It's also a joy to be doing this podcast with Teresa Baltzell, who is a dear friend and a longtime colleague and also my treatment provider. So let me start with just a little bit about me. First, I'm not a clinician or a provider. Instead, I help systems and with organizational change, especially when practices and agencies want to integrate alternatives into their service array. I've also been living with chronic pain for almost 40 years, since I ruptured several spinal discs when I was 19. Today, I'm going to talk about my experience with chronic pain and how it catapulted me into the world of alternative medicine, and what I've learned along the way and ways listeners can integrate alternatives into their own path toward healing and health. Teresa, why don't you introduce yourself before we jump into the content?
Thanks, Jeanne and Kathy. I'm Teresa Baltzell, a licensed acupuncturist and practitioner of classical Chinese medicine. I also have additional education and many years of clinical experience in bioelectrical medicine, biological medicine, neuroscience, and biofeedback. I live in Greenville, South Carolina, voted one of the most beautiful places in the world, top 3 in the United States, just saying, and I'm part of a holistic practice called Carolina Health Center. I think it'd be helpful to also talk a little bit about my background, since where we are in the journey is part of how we got here. I started my career in criminal justice, and as a counselor, eventually ran a prison, and then became the director of quality assurance in the state of Vermont, where I managed the prison system and also probation and parole offices. I became very interested in how we help people become happy and manifest change that they're trying to make in their lives. And specifically for those with mental health issues, co-occurring disorders, what are we missing? What are we not touching upon? What's going on that we're not seeing properly? At that time also, in my early 30s, I also cared for my first husband as he lost his battle with cancer, and I witnessed firsthand the real limits of Western medicine. I decided at that time to make it my mission to ease suffering, and that is really what I feel like I've been called to do, which is to ease the suffering of anyone who makes the choice. I believe that health and happiness are our natural state, and that when we give the body what it needs or remove what it doesn't need, then the body will heal itself.
On this podcast, this is Jeanne again. On this podcast, we will talk about the origins and the anatomy of chronic pain and how alternative non-opioid interventions can help. And we'll offer tips for ways providers can talk with patients and clients about these alternatives. First, let's talk a little bit about the ins and outs of chronic pain. As someone who's had it for decades, I can definitely say and reiterate for anyone who's listening that it's horrible and it's debilitating. I first experienced severe acute pain in my lower back and hip when I was 19 and in college, and nothing seemed to help. And in one of the other SAMHSA podcasts, I describe at greater length the different array of alternatives that I used. But when I found yoga and added aerobic exercise, they both suddenly helped keep that chronic, really debilitating pain at bay. Didn't take it away entirely, but definitely I could keep the pain at bay well enough so I could, go about my daily life. Then it all really changed for me many years later. My chronic pain dramatically subsided, and in many ways went away entirely thanks to a string of powerful healing techniques that I began to use. And they included acupuncture, neuroacupuncture, which Teresa will talk about at greater length later, massage. I made a series of diet changes and later added Rolfing, which is a kind of massage that works with the fascia or the connective tissue rather than your muscles. And I still do regular yoga and I still walk regularly. And I admit it may sound like a lot, but it really isn't. It's just become part of my lifestyle at this point. And I made those lifestyle changes gradually. But interestingly, once I began to feel significantly better and genuine pain relief through acupuncture and neuroacupuncture, the rest of the lifestyle changes became pretty obvious. They were really self-reinforcing.
This is Teresa, and I'd like to build on Jeanne's personal experience and explain more about the anatomy of chronic pain, how it actually occurs in the body. Every living function, whether it's conscious or unconscious, physical or mental, is powered by low levels of electrical current. The perception of pain, muscle contraction and movement, nerve function, glandular secretions, our endocrine system, the body's activity, all are electrically driven functions of your body electric. If you remember, Albert Einstein talked about everything is energy, and here we're talking about the body is energy, the body is electric. Everything is governed by electrical currents. If you think about your heart, for example, which is the most dominant component of the body, the heart is a muscle powered by low levels of electrical current, which we measure and monitor through an EKG or an electrocardiogram. When that electric signal becomes too weak, it's possible to stimulate that life-giving beat with small surges of electrical current from a device known as a pacemaker. Every cell in your body can then be viewed as a miniature battery. The outside of the cell has a positive electrical charge, and the inside has a negative electrical charge. I don't want to get into potassium and sodium ions. It'll be a little too scientific. What I want you to understand is it's the movement of electrically charged particles that form the foundation for every single thing that happens in your body. Granted, there are neurochemicals involved and there's a lot of chemistry and different molecules, But here I just want you to understand that it's about the movement of electrically charged particles. So everything is electric. Your feelings, your memories, and your thoughts are all coded patterns of tiny electrical impulses in your body. Electrical fields help regulate tissue growth, promote tissue regeneration. Electricity controls everything that happens in our body. Interesting that the first use of electricity in the body dates back to 47 AD to a Roman doctor called Scribonius Largus. Scribonius Largus was the physician for a Roman emperor called Claudius. And he would treat patients for gout. And what he would use is electrical eels. And the patient he would either put the eel on the foot, or in this case, usually most people get gout in their big toe. So he would place the eel on the big toe, or he would put the foot in a bath of water and put the eels in the water. And what happens when the skin touches an eel? You get an electrical shock. It's an electrical stimulation. So what happens is that electrical stimulation actually neutralizes pain and eliminates that perception. So let's talk about actually how that happens. We know that pain is an important signal how your body communicates, how your nervous system alerts you that something's wrong, something you need to pay attention to. If we look at the physiology, what we know is that underneath your skin are sensors. These are nerve receptors that sense your surroundings, letting you know temperature, hot or cold, pain or pleasure. They're just below the surface of your skin, and they react to stimuli. That stimuli then produces an electrical impulse. These impulses can become pain messages that actually travel from the nervous system to the spinal cord and up to your brain. So the first part of pain is the perception. Your body senses danger, and then it informs your brain. Pain registers in your brain, and it causes a whole host of reactions. When the signal of pain makes its way to the outermost layer of your brain, called the cerebral cortex, a reaction is produced. Some of you may know the cerebral cortex is where all the sensory information of your body gets processed. Its role is to interpret the feeling of pain and produce a reaction, such as pulling your hand away from a hot stove. So pain is a perception, it's electrical, it has both a cause and an effect, like stepping on a thorn. Pain signals can come from anywhere in the body, tendons, muscles, joints, blood vessels, from the organs themselves. Pain can also have an emotional origin. Chronic pain, the topic of today's conversation, is typically defined as continuous pain that lasts longer than 3 to 6 months. There's some good conversation as to that window, but 3 to 6 months chronic pain. The issue with chronic pain is that it's often accompanied by other emotions. Anxiety, depression, causes a significant reduction in the quality of life. Pain becomes a maladaptive memory pattern that gets etched in the brain and etched in the nervous system. And now you understand how that actually occurs in the body. There's a stimuli, it travels the nervous system, goes to the spinal cord, goes up to the brain, and is processed in the cerebral cortex. Although everyone experiences pain at one time or another, individuals feel and respond to pain very differently. Because we are human, how we experience pain is the same, but because we're individuals, what we experience is different. Each individual has a unique pain threshold, the point at which you first begin to feel pain. Also, each individual has a different tolerance. Cultural heritage, tension, emotions, fears, and expectations all play a role in how each individual experiences pain. Pain has devastating effects on the quality of our life. It affects our mind, our brain, our body, our physical, and our spiritual, or our feelings and our emotions. It affects mental health, employment status, sleep, and relationships.
Thanks, Teresa, for such a thorough definition of chronic pain. So now let's talk about how to heal it, and particularly the value of complementary and alternative treatments. I was pretty confused and skeptical when I was first introduced to alternative treatments, particularly acupuncture, homeopathy, and some energy medicine practices like emotional freedom technique and Reiki. So I studied the literature and got some training in several practices. A really good place to start for anyone interested is the Federal National Center for Complementary and Integrative Health. And I discovered that alternative medicine is actually really popular. 33.2% American adults and 11.6% American children used complementary and alternative treatments in a particular year, according to the 2012 National Health Interview Survey that was sponsored by the National Centers for Disease Control and Prevention. According to a 2009 National Health Statistics report, Americans spent $33.9 billion out of pocket on complementary and alternative treatment. Now, half of these folks don't mention it to their primary providers, presuming their providers won't approve, but folks are using alternatives nonetheless and paying for them out of pocket. And the outcomes are really good too. And I was surprised by the large number of really good controlled studies. These are just some of the groups that recognize, support, or publish studies and other information about effective alternative treatments. SAMHSA, the Substance Abuse Mental Health Service Administration, has mentions alternatives. Centers for Disease Control and Prevention, the Institute of Medicine, the American Psychological Association, the Journal of Clinical Psychology, Yale School of Medicine, the U.S. Department of Veterans Affairs, the Review of General Psychology, the Journal of Nervous and Mental Disease, Lancet, the State of New York. All of those entities share information, publish studies, and in other ways support the dissemination of good, solid, evidence-based alternative treatments. And an ever-growing number of universities and research centers are dedicated to complementary, alternative, and integrative treatments, like Harvard, Columbia, Duke, University of Arizona, University of Maryland, the Mayo Clinic. But as I dove into it, because I was a person experiencing chronic pain, I wasn't a provider, I'm not a researcher, I realized to really understand alternative treatments, I needed to shift my mindset. The more I dove into the literature, the more I realized I needed a mindset shift, a real paradigm shift. Because the truth is, alternative treatments come from a different paradigm than conventional Western medicine. You can't really overlay the two, in many instances, the two paradigms. So let me kind of walk through a couple of differences. I've really identified three differences between the Western medicine paradigm and alternative treatment paradigm. First, conventional medicine separates things into different systems. So you think about, your endocrine system and your respiratory system and your digestive systems. Whereas most alternative systems see everything as one big whole, one big holistic, single system. So when I see Teresa for treatment, she asks me about everything. She asked me about my back pain, of course, because that's the reason I'm going. But then she'll also ask me about my stress level. She'll ask what I've been eating. She'll ask whether I feel hot or I feel cold. She'll ask about my sleep patterns. She'll ask me if my brain is working clearly, if I'm sort of fuzzy-headed, if I'm feeling grumpy or happy or upset. She'll ask if I'm experiencing episodes of depression or anxiety. And she'll want to know all of those experiences I'm having will get formulated into a whole. My physical symptoms, my mind, my emotions, and then her treatment will take all of that into account. The great thing is when I walk out of Teresa's office, I walk out without back pain, yet I also walk out feeling relaxed and more focused and more genuinely centered and happy. The second key kind of paradigm difference between alternative medicine and conventional medicine is that everything in alternative medicine, everything is individualized. So Western medicine strives for systematic generalization. Western medicine wants to be able to make a consistent diagnosis based on a predictable group of symptoms, and those symptoms and diagnoses need to apply for as many people as possible. So when I see my family practice doc or an orthopedist, she'll have a specified checklist that is generalized over, vast populations, and it'll be a checklist of symptoms related to back pain. And anyone with a similar combination of symptoms to mine will get the same diagnosis and the same treatment. Let's say I tell her I have lower back pain, shooting pain down my leg, tingling in my foot, and she'll suggest it's a pinched nerve or sciatica, and she'll order the same tests and suggest the same treatments as she did for the last person complaining about those same symptoms. Again, conventional physicians want to understand broad categories of illness and symptoms, create broad diagnoses, and create studies to determine treatment protocols that can benefit the widest number of people possible. It's not a bad paradigm, it's a really different paradigm. Alternative medicine works in the exact opposite way. The goal is not to standardize, but instead to tailor investigation, diagnosis, and treatment for every unique individual in every unique moment. I might see Teresa with the same back pain radiating down my leg, and the same tingling in my foot. But each time I see her, my entire picture, that holistic picture, is different. One appointment, I might also be really stressed out. Another appointment, I might be having trouble sleeping. And yet another appointment, something really upsetting might have just happened. Or I might be experiencing some mild depression or anxiety. Because she takes all these different circumstances and experience in mind all at once, almost every single treatment session I've had with Teresa is different. So she may, if she's applying acupuncture, she may do acupuncture on different points in my body. Yet every time I walk out of her office, I feel better. My back pain feels better, and my other symptoms feel better. In fact, now I don't even really experience much back pain. So I was recently diagnosed with pericardium effusion, which is fluid around the pericardium. And it wasn't chronic pain and not really relevant to the topic of this podcast, except it really explains the power of acupuncture and neuropuncture as it relates to chronic pain. About 6 months ago, I woke up in the middle of the night thinking I was having a heart attack. My chest was super tight. I was even taking the shallowest breath hurt, and I had pain radiating down my right arm. I totally freaked out, understandably, and went straight to the doctor. And after a bunch of tests, I was diagnosed with pericardium effusion, or fluid in the sac surrounding my heart. It wasn't heart damage, it wasn't congestive heart failure or anything like that, but the fluid squeezed my heart so my heart couldn't beat and pump properly. Nothing else was wrong. All the tests came out normal, so the cardiologist said it was due to inflammation and suspected I had gotten a virus at some point. So she suggested we wait and see whether it got better or worse. Needless to say, I went straight to Teresa. The great thing about most alternative systems like acupuncture or homeopathy is they can successfully treat viruses just as easily as they can treat bacterial infections. And they're wonderfully effective for inflammatory or autoimmune disorders. For example, my homeopath literally cured my daughter when she had mononucleosis, which is a virus. And really all the symptoms went away within days of diagnosis. But anyway, so Teresa, with my pericardial effusion, she immediately started treating both any potential virus that underlied the original onset. She treated the inflammation, and she also applied needles to points that were specific to the pericardium. And I felt relief after the very first session. I mean, significant relief. Now, at first, the relief didn't last more than an hour. The squeezing, the shortness of breath, and the pain returned really quickly. But with each subsequent treatment, my relief lasted longer and longer. And after about 3 weeks, all of my symptoms were gone. All that tightness, all the pain in my chest, my labored breathing, the radiating pain. In addition, after about a month, I lost all this weird inflammation weight gain that I'd been battling for almost 2 years. I mean, it literally just went away. Now, the chest tightness came back once about 2 months later, and so I went back to Teresa. She did another treatment, and I haven't had symptoms since. I mean, I feel great. I feel better than I have felt since this whole thing began. Now, I appreciate at this point, listeners might be asking how much all that cost and who paid for it, and it's true. I paid for it out of pocket. And it would have, I think all the treatments I did with Teresa would have cost about $2,500. And $2,500 is a lot of money, especially out of pocket. But it turned out to be significantly less than getting all the tests and the echocardiogram. And it certainly was a lot less than what I would have paid out of pocket for getting my pericardium fluid drained, getting a stent, and the other suggestions my cardiologist had. So it's important to talk about cost, but it was worth it to me. And my long-term overall inflammation might have sparked even more serious disorders. So it just seems weird to me that my insurance company would have covered a very costly pericardial stent to perpetually drain fluid from around my heart, maybe for the rest of my life, which fortunately I didn't have to do, but wouldn't cover $2,500 that has allowed me to get permanent relief. So the third difference between the Western medicine paradigm and alternative medicine paradigms, and this was probably the hardest to wrap my head around, but also the most important, that difference is alternative medicine essentially adds a fourth meta-discipline. So let me back up and explain what that means. Conventional Western medicine basically rests in 3 scientific meta-disciplines: biology, which includes things like our anatomy, bones, muscles, organs, connective tissue, different systems. The second meta-discipline is chemistry, which explains the actions of hormones, neurotransmitters, amino acids, and other chemicals and processes that send and receive messages. And then the third metadiscipline is genetics, that prescribe who we are or who we are likely to become based on the characteristics of our biological parents and ancestors that have been passed on to us, and how and when certain possible genetic expressions turn on, which is essentially epigenetics. So those are the 3 metadisciplines that inform conventional Western medicine. Many alternative medicine systems add a 4th metadiscipline, which is physics. More precisely, quantum physics, or the physics of really, 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 really small things that we can't perceive with our senses, such as Teresa described, electromagnetics, the action of particles and frequencies. These infinitesimal electromagnetics or particles are being radically changed in predictable ways according to physics, but we can't see them, we can't measure them with our eyes, and typically we can't measure them with the lab equipment that's usually found in most medical offices. Yet a good alternative provider like Teresa can actually measure and then create diagnoses and treatments based on these tiny things that are governed by the laws of physics.
My success with Jeanne, this is Teresa, and many others stems from being able to both treat the symptoms and the root cause. And in this case, we're talking about chronic pain. But remember, when we're talking about chronic pain, as Jeanne talked about, there are so many elements of our body and our body's health that contribute to that. Let's talk about some of the modalities that I use specifically with Jeanne. Acupuncture has been researched and identified by the World Health Organization as an effective mode of treatment for pain relief. You probably know someone who's been treated with acupuncture successfully, or you know someone who knows someone. What we know about how acupuncture works, from blood samples is that the placement of an acupuncture needle in the body activates the immune system, thereby reducing inflammation, down-regulating anti-inflammatory molecules or inflammatory molecules, causes vasodilation, which increases circulation, and stimulates cells for tissue regeneration. This all happens at the site where we place the needle and goes systemic. I practice what's called neuropuncture, which is a cutting-edge system that integrates neuroscience, the study of the brain, how it works, and how it affects the nervous system, and also other Western medical sciences, combines that with this 5,000-year-old medicine called acupuncture. It's not unusual for my patients to experience miraculous pain relief while simultaneously improving other conditions: anxiety, depression, insomnia, addiction, inflammation. So how does it work? Acupuncture points are located all over the body. If you've ever seen that image of an acupuncture diagram, you see lines or pathways or channels. What we know is that these points are located over the body's major nerve pathways. Specific acupuncture points create specific effects on the nerves of the body. By targeting specific nerves, we can actually reset the pain signal to the brain, interrupting the maladaptive memory of pain. This is what makes neuropuncture so effective. When someone experiences chronic pain, what we know is that there's a pain pattern or a perception that's set up in the nervous system. Neuropuncture interrupts that pain signal. So that's the first step in healing the body, is to interrupt the pain signal. We now know that the body cannot heal from any condition in a state of pain. Pain is a sympathetic response. The body heals when it's in a parasympathetic response. Tissues regenerate in our body all the time. Rods and cones in the retina every 48 hours. Gastrointestinal lining every 3 days. Our liver cells every 3 months. That happens when the body is in a state of relaxation or when the body's sleeping, which is why rest is so important. That tissue regeneration ability gets interrupted by pain signal. When someone experiences chronic pain, it also causes an imbalance in the neurotransmitters and hormones. Neurotransmitters and hormones are simply messengers that carry information through the body and help the body experience things like pleasure or pain. When we stimulate specific acupuncture points with pulsed electrical current, we can actually target the release of specific neurotransmitters, endorphins, or other feel-good neurochemicals like serotonin. By resetting the pain signal to the brain and targeting the release of the body's own feel-good chemicals, we can move someone out of pain into experiencing joy and happiness of life pretty quickly. As Jeanne alluded, we can have immediate results. And now let's talk about how we get permanent and long-lasting results. I spoke earlier about the receptor sites under the skin. Well, another effect of chronic pain is that it changes the shape and function of those receptor sites. Receptors, remember, it's what receives information from outside of the body and lets the body know if it's in pain, if it's in danger. These receptors throughout the body create an electrical impulse. As I said earlier, the electrical impulse travels the nerve pathway, spinal cord to the brain. One of the reasons that opioids work so well for pain is because they bind to the receptor sites in the brain and the spinal cord. When the drug attaches to their receptor, they inhibit the transmission of pain signals. We know that receptor sites change shape and function according to various stimulation, like medication. Receptor sites change is called plasticity, and it is the reason why chronic pain sufferers develop a tolerance to pain meds, and then they either have to increase their dosage, take more, or they have to try something else. What happens with opioid medication is that it gives the person a short-lived euphoria which blunts the pain response. The more we take of artificial opioids, the more those receptor sites change, shape, and function. This change inhibits our body's own natural ability to produce its natural opiates. Frequently repeated neuropuncture treatments have been found to restore the shape and function of receptor sites and restore our own natural production of pain-inhibiting neurotransmitters. Treatments eliminate pain symptoms and restore the body's own natural way to be pain-free. Another useful modality is pulse electromagnetic frequency, or PEMF. PEMF is approved by the FDA and is used extensively to treat many conditions: broken bones, wound healing, pain reduction, and depression. There have been more than 2,000 peer-reviewed double-blind studies done all over the world on the benefit of this therapy. PEMF helps chronic pain by optimizing the electrical energy of the cells, capillaries, and arteries. This improvement in circulation alleviates pain by reducing swelling, regenerating diseased tissue, and damaged tissue. Remember, your body is electric. Nothing happens in your body without an electrical exchange. When that electrical signal becomes weakened or disrupted, our body does not function properly. PEMF is used to positively impact energy within the damaged or injured cells. It does this by directly repeating electromagnetic impulses towards the affected cell, enhancing cellular communication. It's not unusual for a patient to find immediate relief from a PEMF session. And as my mother would say, there was a doctor who talked about PEMF and the use of it for wound healing on Dr. Oz. So if it was on Dr. Oz, we need to pay attention. Jeanne, as you mentioned, we need both a holistic diagnostic assessment and a treatment to address all the underlying root causes and symptoms. Because pain is an individual experience with a whole host of causes, we need to get a full picture of all the possible causes and the potential points of intervention. Because anything can cause pain, from a splinter to autoimmunity to cancer to emotions, attachment and loss, grief. We need to conduct a comprehensive biological assessment to see what all is being impacted by the presence of chronic pain. I use specific equipment that measures your body's electrical response. And I want to emphasize here it's electrical, not chemical. So it's not like a blood test. It measures your body's electrical response to various stimuli, pathogens, environmental chemicals, food sensitivities, tissue and organ problems. This is how we identify what your body has and does not need, and what your body needs and doesn't have. This is how we get a whole picture of what may be causing chronic pain and how it might have affected various systems of your body. Neuroacupuncture, pulse electromagnetic frequency, biological assessment, these are just some of the modalities we use at Carolina Health. I have also used emotional freedom technique or tapping. We talk a lot about nutrition, diet, foods, what you put in your body. As we know, food can be our poison or our medicine. We talk about exercise, movement. Jeanne spoke about yoga, walking. We also talk about detoxification, which can become essential resources for helping and release chronic pain.
I appreciate that some of this may sound really technical or complicated and the science is really complex. At least it is for me. And some of these ideas may be new to some folks, whereas some of you may have tried some of these interventions yourself. But hopefully you have a greater understanding of how they work and how to introduce the topic of alternative pain approaches to your clients. Teresa and I talk a lot about this, how to introduce the topic of alternative pain approaches. And what we've What we've landed on is some of the easiest ways to introduce it is just to ask the person to identify what hurts the most, and then see if the person is up for trying one or two new things. I mean, really can be that simple, just starting with one pain, the pain that is most acute in the moment, whether it's crippling back pain or paralyzing anxiety, and then offer one alternative treatment, such as acupuncture or PEMF or emotional freedom technique. We find that sort of cuts through all the complication, and it doesn't require a whole bunch of explanation. It's what hurts the most, and then responding by saying, others I've treated experience amazing results through this particular alternative. Can we try it and see if it works for you? If you're interested in getting more information about the treatments that we're talking about, efficacy research, about other ways that you can talk with clients and patients about the opportunities of alternatives, one place you can visit is my website. There's information from Teresa and from me and from other providers as well. It's alternativebehavioralhealth.com.
Hi, this is Kathy, back again. Thank you all so much, Jeanne and Teresa, for sharing your knowledge, your wisdom, and your experience.
Thank you, Kathy, so much for allowing me to participate in this podcast series. It's been a great honor, and I've learned as much as hopefully I've offered. So thanks so much.
Thank you, Kathy, and it's been an honor and a privilege to participate in this podcast with you and Jeanne today.
And thank you, everyone, for joining us for this podcast. Please join us for our third and final podcast in this series, where we will be inviting Jeanne back to learn more from her. And we will also be joined by Linda Meyer, who is founder and executive director of the support place where Hope lives. They will each share some of their personal successes with using alternative approaches to manage chronic pain. Thank you all so much.